5:30.
And welcome into News Channel 11 at 5:30. I'm Josh Smith. Sarah Diamond will rejoin us from our Kingsport studio in just a few moments with more of the evening news. Starting tomorrow, free COVID-19 testing will be available to all Tennesseans, regardless of symptoms, at drive-through testing locations. One will be held tomorrow at Volunteer High School. That's in Churchill in Hawkins County from 9 to 3. Then Sunday, the drive-through kind of pop-up testing site will be on the ETSU campus from 9 until 3. That's in the parking lot right across from the ETSU soccer fields on Gilbreth Drive. Free COVID-19 testing for anyone in Tennessee begins at the rural health departments across the state starting on Monday. This is an aggressive new testing approach being headed up by the Tennessee Department of Health. And joining us live via Skype tonight, Dr. David Kirschke, someone we've leaned on heavy over the past few weeks. He's medical director at the Northeast Tennessee Regional Health Office. Dr. Kirschke, thanks so much for being with us on the eve of what we know is going to be a very busy day for you tomorrow. Thanks for your time.
Yeah, well, thank you for helping us get the word out.
Walk us through what people can expect if they go to Volunteer High School parking lot tomorrow morning. What's going to happen? We understand you won't even have to get out of your car, right?
No, you can stay in your car. We're going to register you. We need some simple data like your name, address, telephone number, so we can get a hold of you with the results, date of birth, and that's really it. So you can register right on site from your car. Then you'll pull up. You'll get your nasal swab, which involves sticking a kind of a long Q-tip into your nose, both nostrils, to collect the specimen, and then you'll drive off. We are being told that the turnaround time will be 3 days or less, so hopefully we'll be getting the results back in a timely fashion. And then people that get tested, as long as they've given us an accurate telephone number, we'll get a call from a public health nurse within 3 days.
So you're saying anyone with any symptom? Can someone with no symptoms come?
Yeah, so primarily we're targeting people most likely to have coronavirus. So that would be people with fever, cough, shortness of breath. But there are some atypical symptoms. Sometimes people might have diarrhea. Other people's just, body aches, maybe a little sore throat. But really anyone with symptoms that they're concerned it's coronavirus, we encourage them to come out. We can also test people with no symptoms. We don't necessarily recommend that, but we'll not turn anyone away.
If you are having any symptoms, you should already be following the guidelines that have been expressed for weeks that you are not in contact with other people. You're self-isolating. So those people would be hopefully coming out of isolation, getting in their cars and going for testing. Am I right on that?
Yeah, and like you said, we don't encourage people to go anywhere besides just come to get testing. They stay in their car the whole time, and then they can go right back to their house. So yeah, we really encourage people, anyone that's sick, don't go to work, don't go to the store, don't go to the drugstore. If you need something, send somebody else to get it for you. But for this testing, yeah, anyone with symptoms, they can stay in their car the whole time, so they can leave their house, get tested, and go back to their house without ever getting out of their car.
3 days, that's still a bit of a wait, longer than that test we've heard is out there, that rapid test where you can get it in hours. So, this is not, I know, where you wish it could be in terms of a return time. I'm thinking because of that lag, people really do need to go home, and especially if they're symptomatic in any way, to stop the spread. Is that right?
Yeah, so we recommend anyone that gets tested stays in isolation at home until they get the test results back. Yeah. To prevent spread in the community.
Let's talk about the job we're doing. Governor Bill Lee yesterday in a question and answer period actually sang the praises of Northeast Tennessee in terms of the way that the health community has responded by opening up resources for hospitals, and also with the relatively low transmission rate that we've seen here compared to other parts of the country. But then we also heard that there's this tracking site that gave our area a big fat F grade for travel last weekend, over the Easter weekend, that tracked our cell phone usage. I'm curious what you think. How do you feel we're doing based on everything you're seeing when it comes to social distancing?
Yeah, well, I'll have to side with the governor. If you look at our outcomes, so currently our hospitals aren't overrun. We have a relatively low number of cases that's not increasing out of control. and may even be decreasing. We'll see this weekend with the increased testing. Part of the reason we're doing the increased testing this weekend is try to see exactly where we're at. Like, are we missing cases or are we finding most of them? So, I mean, I think based on all of that, I would give us high marks, just like the governor. I really also, really want to send a huge thanks out to really everybody in the community that's, whether it's citizens that are, following the instructions to stay at home and social distance, whether it's city and county government officials, other leaders in the community that are helping, volunteer organizations like the food banks and stuff. Everybody's really pitching in to help with this whole effort. And it's really encouraging to us in public health. We're working hard, but really so is everybody else, including individuals that are, working hard to stay home and be safe.
Yeah, a lot of sacrifices being made. Dr. Kirschke, we every day come on the air and we say the number of cases of COVID-19 went up in our area today. And I want to go back to something you touched on. That number that we see every day is a cumulative number since the start of tracking. We're not reducing that number if someone is labeled as someone who's recovered. We're not lowering that number if someone unfortunately dies. So what I guess what I'm trying to find out is, do you think that we are really truly seeing a regional increase in the number of active cases, or are we staying at a rate that it's remaining somewhat steady? And I know that's kind of a confusing question. Are you following me on that? And what do you think?
So the total number is always going to keep increasing as long as you get any cases, but we're seeing the number of cases we're getting each day is staying steady, and it may actually be decreasing. It's hard to say 100% because there's a little bit of a lag time in test results coming back, but our numbers seem to be either holding steady, the number we see each day, which is low, or maybe slightly decreasing. But we'll get better data after we increase testing in the next week or two to see if that's a true either decrease or kind of flattening of the curve.
We'll be coming to you for your perspective on that. So forewarning ahead of time, we'll be asking for it in about a week when we start to see these. I just think a lot of people right now, Doc, and I know you're hearing this. We heard the president and his staff today saying that the states that are doing well when it comes to healthcare capabilities and transmission rates actually could, within the next maybe 2 weeks, maybe 3 weeks, begin to relax restrictions on movement. Are you hearing any guidance on whether Tennessee could be in those states that might see an early let up?
Yeah, so I know one of the reasons the governor asked for an aggressive increase in testing was to try to get data to make those decisions. So I don't know if anyone's ready to say we will do it in 2 to 3 weeks. I know it's being talked about. There are some things that we in public health think need to happen for us to start, if we were to start relaxing. So we would want to see a decrease in cases because we know the outbreak can start up at any time. We'd want to make sure hospitals are prepared, have enough PPE. Our doctors in the community have enough PPE and can test people. Public health has to be ready to investigate all those cases if there is an increase in case after we start opening up. So there's a number of things that really would need to happen for us to safely open up. But the testing we're going to do this weekend and coming weekends and throughout the weeks will help us have data to know if we can safely do that.
And hopefully the data then will drive decisions. Dr. Kirschke, to you and your staff, it's going to be a busy weekend. We wish you all the best, and thank you ahead of time for all the work your team will be doing. We appreciate it.
Yeah, I really appreciate all the hard work all our public health nurses and other people are doing.
Yeah. And it's really just ramping up. Doc, thanks so much. We appreciate your time as always. Stay with us. We'll be right back.
All right. Thank you.